to bring Floridians less expensive, FDA-approved prescription drugs from Canada.
That's the plan announced by Governor Ron DeSantis this week, an idea one Canadian in North Fort Myers supports.
To be honest with you, I wish we could get our prescriptions down here when we're here.
Beth, who didn't want to give her last name, says prescriptions to the north are much cheaper. That's because Canada negotiates the costs of drugs sold there and keeps the prices low. So Beth and her husband bring what they need with them for the winter.
We make sure we have 3 months worth when we come down.
We want people to be able to get their medications at a cost that they can afford.
Suzanne Van Druss is manager at Discount Med Direct in Port Charlotte. They already work with an international pharmacy to save Floridians money on imported prescriptions. She's not sure how the governor's plan would affect business just yet. Right now, only FDA-approved drugs are legally allowed to be brought into the U.S. and generally not more than a 3-month supply.
And we're basically just helping people to facilitate that importation.
And the folks here at Discount Med Direct say they can save folks 30 to 80% on costs just by buying those drugs outside of the United States.
I had a lady, a widow, that she was paying about $700 a month for her heart medications. And I still kind of felt bad because I was charging her $700, but it was for a 90-day supply.
Savings the governor is working with the Trump administration to bring to more people here.
And this is just one part of what we hope to do to be able to bring some sanity to our healthcare system.
An idea this neighbor to the north agrees with.
I think that would be fantastic.
As thousands of Floridians search for ways to save. In Port Charlotte, Channing Frampton, Wink News Now.
Now, as it stands right now, you can't just walk into a pharmacy and ask to have Canadian drugs right away, so this process is going to take a while. The governor says his plan could save taxpayers tens of millions of dollars, for example, by getting cheaper medication for prisoners in the state.